gather your supplies, right? You do your hi-fi, you hand hygiene, you introduce yourself, you provide privacy, you identify your patient, and you explain. I can hear that you have a lot of secretion, so I will be doing suction on you. Okay.
So number 1 is gather your equipment, which you did. Number 2 is position your client. What position?
What position? Oh, that's not it.
Number 3 is complete respiratory assessment.
So again, don't turn your back once you leave it down. If you have pulse ox, ouch. Put your pulse ox. Make it easy for you. And I listen, right? I listen. Respiratory. Are we having them show it?
Yeah.
We're gonna have you show, during testing, we want you to do your respiratory. Okay, listening. How many parts on the front? 10. Because this is heavy, it's okay. We're not gonna have you do the back, okay? And I'm looking at the color, right? I'm looking at the rising and falling, like Jeanette said, right?
Number 4 is use wall suction or bedside suction and test equipment prior to suctioning client.
What pressure? 120 to 150, right? All right, it's working. See? Okay. All right, next.
Free oxygenate per facility policy.
So I'm gonna go here. There should be one over here, right? The one that goes here.
Yeah.
We can use
It's
it.
weird because that's usually all we have.
Yeah. There should be that, we call it collar. Oh, there you go. You have that. This one's supposed to be on the mouth, on the nose, but this one is we call. There we go. Well, I'm just gonna pretend that it's there. You go there. Okay. Pre-oxygenated. Next.
Unlock suction mechanism and insert catheter 4 to 6 inches into the trachea.
So I connected the suction. I connect wherever this line is. That's the end that you're gonna go. Okay.
Those will already be on the mannequins when you're testing.
Yes. What else did you say?
Unlock suction mechanism and insert catheter 4 to 6 inches.
So let's say it's lock. I'm gonna unlock. Okay. Support the bottom. Here we go. I wear my gloves, right? That's as far as it will go.
Apply suction by pushing suction control mechanism down while withdrawing the catheter.
Until
Suction no more than 10 seconds each time.
no more than okay.
Withdraw suction catheter completely to black mark on suction catheter.
Okay.
Allow 1 to 2 minutes between passes, monitoring changes in respiration, color, etc. Reassess patient.
Okay.
And repeat tracheal suction if needed.
All right. He needs more. I can hear more. I'm gonna go down. And that's how far it'll go. I'm gonna do it again. Remember where I'm holding this? Hold it really well. And I see the black mark. Feeling better?
Once completed, rinse inner lumen of suction catheter with 5 to 10 mLs of normal saline by applying suction while squeezing normal saline.
Hear that?
Yeah. So as you go, suction.
I will tell you, you guys will hear maybe some of the respiratory therapists that don't suck it out right away. Just realize you're putting water in there, right? You're putting it in their airway.
Right,
yeah.
I know people have their own techniques, but I wouldn't feel comfortable. So you're gonna put it in and suck it out because the whole point is
Sucking
cleaning
it out,
this.
cleaning this.
That's all.
And was it you who asked me?
Yeah, like every.
Is it every time? Technically, it's that one time at the end, right? But if this is so gunky and you feel the need to do it each time, then go for it. But know that whatever you're putting, it can go down. So be really, really careful.
And then place suction mechanism in locked position. That's where
You
sometimes
pull
we
up,
forget.
you pull up, twist, now in suction. And then
Document procedure.
document,
You would
Wash your hands.
reassess your patient. Yep.
Can you show us
100%?
how not to hold it? You know how you were saying like some people hold it.
Oh.
Yeah, it's really
Right
bad
here.
holding.
see this
maneuver.
end?
Yeah.
You hold that there.
Yeah,
Where,
okay.
see my hand?
Yes.
Because if not, because that's what you're trying to put. If not, see this is easy to come out.
So if you are putting it in like this, that's fine. If you pull out like that, I'm gonna tell you no. I'm gonna, you're not passing with that.
So you're
If
holding.
you pull it out without holding it down,
Gotcha.
because that's dangerous.
Okay.
Do you have a question?
It doesn't say anywhere on here, but it is a sterile procedure, right?
So you are not sterile because it's a closed system. That's why it's easier because it's a closed system. You don't have to get sterile.
Okay.
If it is
So
open,
inside-
it is.
It's yeah.
Okay, good.
Okay, I just saw when she said that it was a sterile procedure. I just want to make
Yeah,
sure that
it's sterile in there, but you don't
It's
have
sterile
to
don't
when
have
it's
to go,
open.
like,
because it's
okay.
all closed up.
All right. Okay.
But remember, I told you, you will still wear gloves,
Wear
although
gloves,
it's
right.
it's closed because what can come
But
out?
we don't have to do the sterile. Okay, I just want to make sure.
Only
That's
sterile
where I mess up.
when it's open suctioning.
Inside, it's sterile. This is just, it's quicker. These end-line sections are quicker. It's easier. It's less steps.
If I have a trach patient with inline, I'm fine.
Totally happy with that.
And if
I'm
it
happy
was
about
the open one, you would be sterile, correct?
Yes.
Yes, so
That's when
you,
you would do the sterile.
Yes.
so you would use a suction kit, just like the one that you use for the oral nasal, and you have to do all sterile, and you would go in like that. So that's exactly how you would do it if you don't have a closed system.
You know what she showed you last week for nasopharyngeal? It's the same system. So I'm doing my opening. I put my sterile gloves, right? Same thing. Instead of this, you know which one is your sterile and not, right? Make sure it's connected. I'm wearing sterile gloves, right? That's where you go. This is what we considered open.
And then you use that the sterile gloves.
Yes, sterile glove. Same thing. Support this one. See the difference? See now which one do you like?
That one.
You like this one?
I better close.
Yeah, because
Good luck to
Because you
you.
don't,
you're
you
advancing.
can see how much you're going in. The other one is like.
It's not see, it's feel and the gag reflex. It doesn't matter. You don't need to see.
I just feel like that one's safer though.
There is a pin.
I like the
Let's
other
just say we can agree to disagree.
The fact is that you have less opportunity for
For infection.